All right, so what I'm going to be doing today is just doing a very brief acknowledgement of our Snap Star Awards people. So the abstractors every year go through the audits, and it's to make sure that all of their data is correct. And we do ask, and they're graded on this in your P for P for sure. And in order to pass and get all your points, you have to be at least 98% and above. So the abstractors that I'll be showing here in a moment were the ones that were acknowledged yesterday in our in-person abstractor meeting. And we have 7 that were 99.5 and above. So they did an extraordinary job. So when they get that high of a score, they're exempt from the audit the next year. And we don't we don't like to use the word audit, so we call them snap reviews. So it's sharing knowledge and perspective, because there are also very big teaching moments that we do. And they're responsible. We go through usually about 36 cases for both wrong cohorts and actual cases that they performed throughout all the modules. So of our stars, here they come. So what I'd like you to do is actually, the abstractors that are here, when I call your name, if you can just stand up so we can acknowledge you. They were given their awards and certificates yesterday. The first one is Bobby Copen. She's from Q-Centric Sparrow. She's not here today, but Hannah Monsma from Trinity Grand Rapids. It's doing perfect. Kara Tiger from UMHS West. Perfect. Kristen Watson from Children's Hospital Detroit. Kristen's a 2-time winner, just to let you know. Rachel Wesley from Henry Ford, Warren Madison Heights. Stephanie Floor is from ECS, and she's not here, but she does have her ECS people representing her. And then Vita School from Michigan Medicine. Okay, thank you so much. And then on to Katie.
Hello, everybody. I have the honor and pleasure of announcing our 2nd annual Quality Improvement Award winners. So this is something that we started last year to recognize some of the amazing interventions that are ongoing at your sites. The criteria, we talked a little bit about this, but last year, but sites are able to submit up to 3 interventions for consideration for Quality Improvement Awards this year. The submissions just included a brief description of the intervention, kind of objectives, methodology, things like that. We also considered sites that did site success presentations for us this year. And we reviewed those internally as a coordinating center and voted, and we've got some amazing winners and honorable mention that we're going to share with you all today. So these are the categories again. We'll go through each one of these. We've got 4 awards. First up being most innovative intervention, and that is going to Children's Hospital of Michigan for their intervention related to driving timely steroid administration through nurse engagement. And I forgot to mention, if you guys don't mind coming up, grabbing a certificate, and we're going to have you take a picture off to my right, your left here with our directors. So if you guys, want to come on up. So they have done amazing work engaging with their nurse educators and their nursing staff to support their time to steroids intervention or metric, which will now be incorporated into our asthma care bundle. Let me get you guys here. They have established a nurse champion role at their site to help, again, champion this work, not just with their providers, but with their nursing staff. They have launched a verbal nurse action protocol for steroid administration, so their nurses can order steroids during the triage process. And they've integrated that nurse action protocol into their nurse onboarding and competency training for their group. And they've also started bi-monthly recognition program for nurses and included them in their annual high value care awards. So congratulations, guys. Thank you. Next up is our most impactful intervention, and we are awarding that to Holland Hospital for their amazing work with the naloxone distributions. They developed a nurse-driven protocol that has led to significantly increased naloxone distribution at their site. So yeah, if you guys don't mind standing up and come accepting your award and taking your picture, thank you. So they developed protocols and order sets to support nurse-driven distribution of the naloxone kits. That for you guys. Yeah. They sent individual provider feedback on the number of kits that were distributed and some missed opportunities, and this led to a 60% improvement in their naloxone kit distribution, which led to them being our top performer in the collaborative last year for 2024. And then they commented that they're looking ahead for ways to expand naloxone kit distribution to other units of their hospital, not just ED, but also for admitted patients. So congratulations, you guys. Thanks so much. Next up is most effective use of data and analytics, and I am excited to award this to the Henry Ford Health Group, Henry Ford Detroit specifically for their work in enhancing provider engagement with the PE diagnostic yield measure. And yeah, so Heather, Dr. Parada, congratulations. I'm not going to go too much into this one because I think Dr. Parada is actually presenting on this a little bit later this afternoon. Wonderful. Great, thank you guys so much again. You'll hear a little bit more. I don't want to spoil anything for this afternoon. He'll do a much better job explaining it than I ever could. And last but not least, this one's a little bit different this year. We're going to go through our excellence in collaboration and teamwork. We had some really amazing submissions for this, but I think we wanted to highlight particularly our pediatric readiness pilot sites because I think we didn't realize how much of a group effort this really would turn out to be. And now that we're expanding this to the rest of the collaborative starting this year, I think we're really seeing some amazing work in the pediatric readiness space beyond just like our medic core team. So we want to recognize our emergency care specialist team in their partnership with the Cornwall West hospitals, our Trinity Health Livonia and Grand Rapids teams, and as the Kalamazoo Beacon, formerly Ascension Borges team as well. So I have certificates for all of you guys. If you don't mind coming up, we'll do just maybe probably one big group photo, but again, thank you so much for all of your work in the pediatric readiness space. And I encourage anybody in this room who has questions about pediatric readiness and how that looks to definitely, I mean, we're happy to help answer questions, but reach out to any of these folks over here. They did an amazing job with their teams. And again, I think this is a little bit different of an initiative for us in that we have been working with a lot of folks external to the core medic group, and it's gone really, really well so far. And then we do just want to highlight a couple of additional submissions that we received and a couple of folks that have presented for us. So again, Henry Ford Health system-wide intervention. They have taken a rotational leadership approach to Medic QI. So they meet regularly as a system, talking through different quality improvement interventions that they can implement. And also the McLaren group, who's new to us, but has been doing some amazing work already related to some dot phrases, smart text phrases to support real-time clinical decision-making, again, across the McLaren system. So thank you guys. And then also some additional interventions, Henry Ford Detroit for their front-end redesign. We'll hear a little bit more about that this afternoon as well. Henry Ford Fairlane for some pediatric-focused redesign at their freestanding emergency department hospital. They have done some really amazing work in equipment organization and things like that. The ECS team for their standardized PE care pathway to increase safe discharge for the low-risk PE patients, and U of M Health West for their smoking cessation success that they presented for us earlier this year.